right, the doctor has ordered that after the second liter of normal saline, we're to discontinue that and give 2 milligrams of Dilaudid every 2 hours. So we're going to dilute that with 2 milligrams of Dilaudid per 2 milliliters. No, yes, 2 milligrams per milliliter, and with 2 milliliters of normal saline. So because I don't have a saline lock here, we're going to say that what I've done is I've disconnected the port up here where the saline lock would be, so that it won't spew blood and saline out. And then I've disconnected my IV. It's turned off. And getting it cleared out of here. All right, so Ivy, give me your name and date of birth, please. Thank you. We got your IV discontinued. We're going to give you some Dilaudid now, which is going to help with pain. So we've got the right dilution of Dilaudid here. It's been opened, but it's been dated and it's not expired. First thing we're going to do is we're going to flush the port. We'll drop our medication first here. Cleaning off the top. So I need 1 milliliter to get 2 milligrams of Dilaudid in here. So I'm going to inject 1 milliliter of air in. And I'm going to draw up 1 milliliter of medication. Have verified my patient, right medication, the dose is correct, the route is correct. I will document my administration. Okay. Now since I still have this here, I'm going to get another alcohol swab and wipe off the port and just pull 2 milliliters of saline out of here. So we're drawing it back to 3 milliliters. Safety needle, taking it off. Sorry, I was trying to show you my dosage. I wouldn't normally have done that, but there it is in all its contamination. So I've got my port cleaned, medication drawn up, and I hope this connects to this. Okay, so now I've got 4 minutes to do 3 milliliters. I'm starting at 3:31, so we're going to go to 3:35 in 30 seconds. Get a little flush out of there. I forgot to flush before I put this in. I would normally have put half of my flush syringe in that to flush it out. We're at 1 minute. How are you feeling, Ivy? Are you having any pain? The infusion site is good, hasn't infiltrated. It's not irritating the patient. She's not having any discomfort from it. Okay, we're halfway through. I gotta turn my watch better here. Okay, my syringe is just about empty, and then I'm going to get my flush so I can get the rest of that in within this 4 minutes. So taking my syringe out. Connecting my flush. Slow it down a little bit here. It's backing up because I have that still connected. All right, so there's my 4 minutes, and now I'm gonna flush the rest of the line here. Make sure it's good and empty. How you doing, Ivy? Good? All right, awesome. So this is gonna help with your pain. Oh, let's pull that back out. That's all we want there. Okay, so reassessing my site, and there's no infiltration. Everything's good. My IV bag has been disconnected because we're only going to here now. And I will document. So here are my orders, my calculations. I've documented my first 2 medications, and this one will go on after that. And the MAR. Okay, so now, okay, Ivy, we're good to go. We're gonna take off your IV. So I'm gonna take off this tape. I hope it's not too sticky for you. Okay, stuck on this gauze. Okay, I'm gonna get some gloves on. So that the tape can stick to my gloves. Probably more tape than I needed here. I think I was planning on going over both lines. Pulling gently. And the tape broke, so I'm going to do this one. And release the chevron. Looks like my 4x4's got all used up. My 2x2s. Just pretend that's what this is. Chevron off of here. This tape tears nicely, so that'll come off okay. Taking my gauze out, holding my port steady as I can. Tearing gently. Holding the skin, holding the port. Sorry. Can you see that? This is so stretchy. It's hard to really get a good feel for how it's coming off. All right. So I'll use this. Can pull it out. Awesome. Right into the sharps container. And then I've got my next 2x2. I'm going to put on here, hold some pressure for a few minutes. Put a Band-Aid on it, clean it up. All right, Ivy, I think you're all set, and you should start really feeling better.